What do you think, Laura? Go ahead. Yeah. Okay. Well, I know people will probably keep trickling in, but looks like we've got people here. So, we are excited and thrilled to have Dr. Priya Saha presenting today. She is one of our incredible pediatric hospice and palliative medicine fellows this year, and she did residency here at Children's, went to cardiology fellowship at Stanford, and then we were thrilled that she came back to join us for this year and have just learned so much from her and had such an incredible time working with her over the past year and are thrilled that she will be staying in the area this coming year, working at Mary Bridge in pediatric cardiology and bringing palliative care more into their pediatric cardiology program there. So, really excited to hear Priya's talk today on legacy and meaning. Thanks so much, Priya.
Thank you, Paula, for the kind introduction. And thank you, everyone, for coming to Grand Rounds today to hear me talk about legacy work. The title of my talk is Legacy and Meaning, the Role of Legacy Work in Palliative Care. Before I begin, I just want to take a moment to say a few things. First, I want to acknowledge that I'm standing on the traditional and unceded land of the native Coast Salish peoples. I also want to recognize that today is a day of remembrance. It is National Day of Awareness for Missing and Murdered Indigenous Women and Girls, often called Red Dress Day, and which was brought to my attention by one of our colleagues in the Seattle Children's Palliative Care Team, Acacia. And so as I talk about legacy today, it feels especially poignant to honor and remember the unseen legacies of so many women who were stolen from their communities. And lastly, I can't talk about legacy without talking about culture, as I've already done. And so I want to also mention that I will continue to refer to different cultural traditions and practices, some of which I don't have firsthand experience of. And so my goal is to not speak for other communities or to generalize experiences, but to explore how culture and values and meaning making shape the way we think about legacy. So to start off, I'd like to invite everyone to reflect on the word legacy. And if it feels welcome for you right now, I invite you to think about someone in your life that you have lost, and alternatively, to consider what you would want your own legacy to be. So what does legacy look like? What legacy do people leave behind? And how would you define your own legacy? And now, having done that, I'd like for you to shift your attention briefly to a case that I encountered about a year ago and reflect again on how legacy shows up here. So this is a case of a newborn infant with a life-limiting genetic syndrome in the NICU who's on comfort care. The parents shared their preference to return home and to be informed by the team when their baby has died. And before leaving, they place a picture of a Hindu deity at the head of her crib. As the days pass and the baby progressed towards end of life, the nursing staff shared their sadness that the baby was alone without her parents. And the parents had already declined their offers to create a memory box. The nurses went ahead and built the memory box anyway, and it included handprints, footprints, photographs, and a lock of hair. And they hoped that by gifting the parents this box, they might pass on this baby's legacy and mitigate future regret that they might feel in not participating in the legacy building themselves. And so with this case, I invite you to consider, what is this child's legacy and who does it serve? And now that you've all taken a moment to reflect, what I hope I've allowed you all to do is begin to see the various ways that legacy is shaped, and with that, set the stage with 3 guiding questions for my talk today. What is legacy? Who does legacy serve? And why does it matter? If you look up the word legacy in the Oxford Dictionary, you'll find these two definitions, one being synonymous with a bequest, often money or other tangible thing of monetary value handed down by someone who has died. A second definition captures the intangible that's passed down by a predecessor, and that has a long-lasting effect on others. In modern times and in our modern use of the word, we've vastly expanded the definition of the word legacy to mean much more. Legacy can define a person's purpose by prompting someone to explore how they want to live their life today so that they're remembered tomorrow, and what they want to do with their life so that they leave an impact that transcends their existence. So legacy has taken on a much deeper and more existential weight in our lives and has become an essential way for people to derive meaning from life. Now, how do we define a person's legacy when life is cut short, before personhood can fully mature according to the individual's own will and actions? And so it's important to note that legacy as purpose does not always apply, and especially for very young children or individuals with lifelong medical complexity, legacy is often shaped by the memory of those who knew them. These are images courtesy of Illuminations, which, as many of you are familiar with, is an incredible organization here in Seattle that offers pro bono photo shoots for families that are experiencing anticipatory grief and loss. Legacy is also intertwined with our heritage and is shaped by our past and those who came before. Legacy is part of our heritage as a way for people to honor their ancestry and immortalize their culture and customs. And now, having looked at legacy from a global perspective, I'd like to talk a little bit now about how legacy has entered the lens of Western medicine. And this has happened specifically through the work of Dame Cicely Saunders in the late 1990s, who, as we all know, is recognized as the founder of hospice and palliative medicine. And Dame Saunders recognized the importance of legacy building and what it means for people in their lives, and emphasized the importance of listening to patient stories, humanizing them as people who have meaning and purpose even as they're dying. And in so doing, she created space for patients to reflect on their life's legacy. And since the pioneering work of Dame Saunders, many others have examined the role that legacy plays in patient care, and legacy has evolved into recognized therapeutic interventions that supports not only patients, but also families through the distress of serious illness, death, grief, and bereavement. And so here I define a new term. From legacy comes legacy work, which is used to describe the variety of activities that allow people to reflect on life experiences and document life stories and values through tangible and intangible means. As we talk more about what legacy work looks like, I want us to think about who the legacy work is for and why it matters. And I'll talk about legacy work using this framework that classifies it into three buckets. We have primary legacy work, which serves the individual and focuses on how the individual wishes to be remembered, and the impact they want to leave behind. There's also secondary legacy work, which serves those who survive the loss and who knew the individual, such as family and friends, and focuses on how they wish to memorialize an individual after their death. And then we have tertiary legacy work, which serves the greater community and society in which an individual lives and focuses on the individual's impact as it's recognized by society. So primary legacy work often emphasizes the intangible elements of an individual's life that define how they hope to be remembered. And this often involves reflections on life experiences, values, often expressed through a person's final decisions and choices and their connections with other people. Primary legacy interventions, as we see them in the healthcare space, are rooted in Erikson's theory of development, which, as many of you know, describes 8 essential conflicts that an individual is expected to encounter through life. And primary legacy work is really embedded specifically in stages 5, 7, and 8, in which the resolution of these conflicts allows a person to, respectively, form a coherent sense of self and values, pass on these values to the next generation, and accept life with meaning rather than regret. So one of the first interventions that came out of this theory is life review therapy, which was proposed by the geriatric psychiatrist Dr. Robert Butler in the 1960s. And Dr. Butler recognized that reflection and integration of life events occurs naturally with aging and can often be cathartic for people who are kind of entering those final stages, stages 7 or 8 of their development. But he also noticed that when there are unresolved life conflicts and regrets, reflection can become pathologic and lead to rumination. And so what he did is he formulated a structured set of reflections for examining, organizing, and making meaning from one's experiences to lead to positive resolution of conflict. In the mid-1990s and early 2000s, Dr. Harvey Chochinov formalized another intervention known as dignity therapy. Dr. Chochinov once described seeing the skeletal form of an elderly man who was dying and noticing a photo of him in his younger days as a muscular and athletic man that was sitting next to his bed. And he recognized how important it was for this man to preserve his own self-perception as a younger, more able-bodied person, even as he was losing that self through illness. And so through dignity therapy, Dr. Chochinov encouraged individuals to rewrite their life story, anchoring in the experiences that are most meaningful and most important to them. Examples of interventions that are inspired by Life Review are many, and one more that I'll talk about is the Legacy Project, which started as the Life Tapes Project by Dr. Rosenbaum at Stanford and involved having cancer patients and their families make audio and video recordings of their life stories. The recordings then were preserved and served as meaningful keepsakes for family members. And eventually, the Life Tapes project evolved into more material projects, including written letters, stories, ethical wills, scrapbooks, and legal planning documents for families. In the pediatric space, primary legacy work can be more challenging and needs to be developmentally appropriate to the age of the child. And so it often ends up involving more creative forms of expression through art and writing. And I'd just like to share one of my favorite examples of this legacy work through work done by a collaboration called Words of Courage between Partners in Print, which is a local letterpress program in Seattle, Writers in the Schools, and Seattle Children's Hospital. And this collaboration engages kids in writing poetry, which is then crafted into these beautiful broadside letterpressed prints. While not necessarily intended for end-of-life legacy making, these broadsides do become important pieces of legacy work for kids and their families to be remembered after they're gone. And this particular broadside on my slide here, titled Have I Ever, is from this year's portfolio and is by a girl named Abby, who is very well known to our team at Children's and died earlier this year. There are many benefits of primary legacy work, which most of us could probably intuit, But also, which we have studied and it's panned out in research, primary legacy work can help mitigate the existential and psychological distress surrounding end of life. It can improve life satisfaction and self-esteem, reduce depressive symptoms and anxiety around death, and improve preparedness for death, and also improve relationships and bonds with loved ones as they prepare for loss. So now, as we talk about the benefit of legacy work on loved ones, I'd like to now talk about the second tier of legacy work, secondary legacy work, which is the work we do for those who survive the loss of an individual. And the emphasis here is on staying connected with the dying or deceased and processing grief, sometimes through more tangible means. So for many of us who work in palliative care, legacy in the healthcare setting has become somewhat synonymous with material objects, such as hand molds, handprints and footprints, scrapbooks, jewelry, artwork, and so much more. And these material forms of legacy work are important, especially in the pediatric setting where, as I mentioned before, primary legacy work can be quite challenging. And legacy building activities are now offered almost universally at all pediatric facilities across the US and has become standard practice for child life departments. In addition to having keepsakes, the process of creating legacy items can often be supportive for families as they navigate loss far from the comfort of their home. Now, while legacy activities are an important element of the care that we offer and provide families, I'd like to point out that it's important to note that legacy work extends far beyond the reach of the hospital and includes the material and immaterial possessions of loved ones, like jewelry and clothing, household items, and the intangible things like the stories, the recipes, the family traditions, the little moments throughout life and throughout knowing a person and the values that they leave behind. And secondary legacy work continues even after death and throughout mourning. Legacy is built during funerals, celebrations of life, memorials, through practices such as eulogies, in gatherings over cups of tea during which stories are exchanged. Legacy is built through spiritual mourning practices as well. In many East and South Asian and South Asian cultures, the mourning period is long and often involves rituals and customs that are designed so that people continue to remember the deceased long after their death in their day-to-day. And so I'd like to draw attention to these two photos in the middle and the bottom here. This picture is referencing a burial practice in Ghana where people will create, quote, fantasy coffins, which capture the essence of the deceased individual. And the bottom picture here of the bird next to this leaf of food, I wanted to mention a personal cultural tradition in my family. When my grandfather died, we set out a plate of his favorite food each evening on the terrace of his home in Kolkata for birds to eat. And it was believed that the birds who come to the food carried his spirit and brought him home. Secondary legacy work is important for a number of reasons and is rooted in the continuing bonds theory of grief coined by Dr. Dennis Klass in the 1990s. And this theory posits that healthy grief actually promotes maintaining, enduring, and involving connections with the deceased. And so this was a real shift from prior grief theory in which the function of grief and mourning was to detach and to move on and let go. Secondary legacy work supports people in fostering new connections to the deceased, and in supporting them through anticipatory grief and during the grief and bereavement process, and to build meaning from the loss so that their relationship endures throughout life. Now, while the importance of secondary legacy work and its impact on grief and bereavement cannot be understated or overstated, I'm going to pause here to make just an important note of caution as well when offering legacy work to families in the healthcare space. As with any intervention that we offer to patients and families, it's important for us to remember that benefits of interventions are dependent on targeting the right intervention to the right person at the right time and in the right place. And there are several reasons why offering legacy work to families may not be appropriate. For example, for some family members, introducing legacy activities at the wrong time when they're not ready for it may heighten anxiety and signal to them that death is imminent. Additionally, there may be clinical barriers in which particular legacy activities are not welcome, for example, with handprints when wounds are present. And some activities may also be culturally inappropriate or insensitive. And just to name a couple examples here, in cultures where prognostic disclosure to a patient or family is taboo, offering to write something like a goodbye letter may not be welcome. In some cultural groups, image making is discouraged. And so assuming that photos are inherently comforting for families when approaching end of life or loss may be inappropriate. And in some Hindu traditions, such as the tradition in my family, the body after death is often considered sacred with spiritual significance. And so activities that involve cutting hair or removing bodily materials can feel violating. And so these examples just highlight the importance to offer legacy activities in a way that's culturally sensitive and free of assumption or bias about what good legacy work should or could look like. And now I'll move on to the third tier of legacy work, which is tertiary legacy work, and focuses on the legacy work we do for society. And the emphasis here is on memorialization of an individual and their positive contributions to their community and to society at large. Tertiary legacy work takes on many forms, and just to name a few, we see legacy through biographies, documentaries, physical monuments, and intangible honors and awards. And I've included 3 pictures here to just represent some important legacies that surround us today. In the top left corner, we have Alfred Nobel, who in 1895 signed his last will and testament, leaving much of his wealth to support what we know today as the Nobel Prize. In the bottom left is a commemorative plaque that many of you may recognize, honoring Dr. Pat Fleet, someone who I am so happy I got to learn about during my time at Harborview last month, and who was a beloved nephrologist and educator at Harborview for over 40 years. And his legacy lives on through the Dr. Pat Fleet Endowed Fellowship in Nephrology, and in this plaque on, I believe, the 5th floor of the East Hospital at Harborview. And of course, I would be remiss to not mention Dame Cicely Saunders again, whose legacy much of our work in palliative care is born from. Tertiary legacy work is also important and serves many important purposes in society in helping us preserve our collective memory and history. It serves as a vehicle for transferring cultural values across generations and inspires future action. So I've talked about 3 tiers of legacy work, But I want to take a moment now to touch on an important and maybe overlooked form of legacy work that's essential to all of us here in this Zoom room today. And that is the legacy work that serves us, the healthcare provider. In healthcare, we often experience a type of grief that has a name and was coined by Professor Kenneth Doka as disenfranchised grief. And this is grief that goes unseen or unacknowledged because the relationship with the deceased is not socially recognized or valued. But regardless of how we define our relationship to our patients, the fact is that we do grieve and we feel the pain of loss, and often without having the usual avenues to process our grief. And so legacy work is essential for us as providers to cope with loss and grief too. And we do this through a number of venues and forums. Some services or teams have a practice of doing death or memory rounds, often immediately after or the day after a death on their team. Other teams, such as our teams here in palliative care, have routine remembrance rituals to recall recent deaths and to remember the personhood of the people that we took care of. And hospitals and institutions sometimes have annual memorial services that are meant to honor all the patients served and who died in the care of their institution. Participating in this type of legacy work is important for sustaining not only the wellspring of emotional resilience that we need to do our day-to-day job, but also to prevent burnout. And our work is inherently relational. When we talk about our patients and remember them as people, we humanize them and recognize that our patients matter. And it's important also to recognize that even in offering legacy work to patients and families in culturally sensitive ways can have positive effects on us too, because often in a time when everything else feels unfixable and broken, offering something like legacy making can feel tangibly supportive and positive. So now I'd like to return to the case from the beginning of my talk, where we learned about an infant who is approaching end of life in the NICU and her nurses who decided to build a memory box for her to support the parents and what they worried would be future regret about not being at bedside and not participating in memory making. And so as you think about this situation and think about all that we've covered about legacy work and what it looks like, I invite you to reflect once more on the following questions. What defines this child's legacy? To what extent is her legacy contained in this memory box? And who does this memory box serve? And with that, as I close, I want to leave you all with 3 summary points or reflections. 1, legacy work allows us to derive meaning from loss and grief. Legacy work, as we've now seen, is truly boundless and broadly defined and informed by the person, the place, and the culture in which it takes place. And when we participate in or offer legacy work to others, it's important for us to consider who it serves and the purpose behind it. And with that, I'd like to thank everyone for joining me today and participating. I recognize that I ended much ahead of time, but that means I have much more time for questions or comments from anyone. So thank you and open to any feedback or comments. Not sure how to stop sharing my screen. Maybe someone can help me with this.
See a couple people with their hands up. First of all, thanks, Priya, so much. That was great. Oh, sorry. Put on my video as well. But I see Erica has her hand up.
Thanks, Paula, and thanks, Priya, for this amazing. I mean, this was really great, a really great talk. And I'm just thinking about the palliative care team at Seattle Children's, as well as the Journey Grief Support Program at Seattle Children's, and the impact of us collectively as clinicians doing legacy items for families if a family has either declined legacy items, or if uh, I mean, I'm thinking about families who have told us that some of these things are creepy, right? I mean, those are literally the words that they use. And we see these families at the Journey Grief Support Program and their grief and bereavement. And I don't think what we as clinicians don't recognize is the significant harm that sometimes doing this, just like you shared in the case study, right? That the significant harm that doing legacy items when we don't fully understand a family's culture, both within the family and broader, can have, because we hear about it here at Journey. And we hear about the impact of the grief on their grief. And I'm just sitting here, like looking at my cabinet here, in which I have legacy items that I've had for years that were done to ameliorate a family's grief in the future. And one of the things, and families decline to take them, right? And one of the things that I think is important for us to recognize as part of the grief process is that if a family does have regret about not having said yes to legacy items, that is in grief counseling and in grief therapy, that is something that then gets integrated into their grief process, and that they get support around, right? So I think you bringing up like, who is this for, right? Because sometimes it is for us, and finding a way to recognize that in ourselves and not force something on a family that potentially could cause harm. So thank you for the whole talk.
Thank you for sharing that. Oh, looks like there's more. Sorry, I am looking for someone raised their hand. Andrew.
That was me. I'll unmute. I was just waiting to get called on. Thank you so much. This was a wonderful talk and just really powerful stuff, and a wonderful blend of sort of stuff you'd researched plus your clinical and personal experience. What comes up for me is just, and I don't have my computer, but I'm so curious about what Ethnomed has on this, because that's where I would look and should look and haven't looked. And it's like, oh, because you gave tidbits, but it's like, I should definitely know for like at least the top 5 and ideally 10 sort of Seattle area immigrant communities. To what are the landmines not to step on? What are the sort of things to be at least circumspect and sort of cautious and curious around, so that I'm not enforcing or inflicting kind of eager legacy harm on folks, or what are opportunities for practices that are missed opportunities from providers. So anyway, just something that maybe Duncan, who I think is currently curating Ethnomed, but that would be a wonderful place to see what there is and consider updating or enriching, because it's so important. Thank you so much.
Yeah, thank you so much. And I actually did visit the Ethnomed website during my research. And although it doesn't speak specifically to legacy making or legacy work, there was a lot of really great information on different cultural practices around death and mourning and like funerary practices, which I found really helpful.
And I'll add one other thought that I've kind of run into is the complexity of not just culture, but the multi-generational immigrant culture, where it's like, you guys are from X, but then how American is this generation? So that you can you can get stuck in thinking that this family is Somali, but actually, there is the cultural expression is so complex and multifaceted that one of three children may be very American in how they are approaching this aspect of their mother's journey, and the other two may be very less American. So it's just something that, again, our reflex is to step back and be curious, and then quiet can be really powerful to understand where folks are coming from. Thank you.
Yeah, thank you. Thank you for that reflection. And it's something that I often think about as well. And I think culture as a term and concept is often kind of treated as a monolith. And I like to kind of remind myself that culture is very personal and can be defined on an individual level. And sometimes as providers, we do end up making unwittingly making assumptions about someone else's culture because of like the family that fabric that they come from, or their place of origin. So thank you so much for that comment. Okay, I see two hands. David.
Thank you, Priya. This is just so wonderful among other things, as an invitation for us to really consider legacy in a broad context. And I like the framing of the developmental tasks that are before us, and how maybe our needs might actually change as we sort of move through our own development as individuals. And, I was particularly pondering, well, here I am at the end of my career as a palliative medicine physician, formally at least, and thinking about, well, what is my legacy now? And just sort of being steeped also in a family tradition of legacy. So my mother, I'm just going to vamp on this just for a little bit, was very intentional about her legacy. And she started a couple of decades before she died, maybe even more than that as I think about, in sharing her story with us from the incarceration experience in World War II for Japanese Americans, speaking to the cultural aspects of legacy work. And, of course, there have been many others who have built a legacy out for that cultural group, such as the Densho Project being one notable example, among many others. But she really kind of shared legacy with us from very early on. I was probably 10 years old when she started talking about that incarceration experience, and she eventually wrote about that and published her memoir. And so I was sort of steeped in this. And now to kind of think about, well, what's my legacy? What am I leaving here for others? And what is it? What matters most to me from the time that I've spent? These are highly relevant questions. And, I'm not going to take all the oxygen out of the room to talk about my legacy, but I just wanted to share how meaningful it is to me to hear you bring this topic up and really invite us to reflect. And that's what it's all about when it comes to thinking about, well, what has it all meant? So thank you for that.
Thank you, David. Thank you so much for sharing and sharing about your mom too. I see a hand from the children's team room. I think you guys are still muted. Maybe if you want, you could share it in the chat or text it to me too. Oh, there we go.
Is it unmuted?
Yeah.
Wow, Zoom on this beast is very tricky. I was just saying thank you so much, and for everyone else who had shared. And I was also thinking about what Erica had shared about the legacy items on her desk. I have fingerprint molds that remain molds because even though the family requested them, they were never in a place to decide what they wanted for them. And locked in your drawer, yes, all of them. But they were never in a place to decide what to have done with them. And after over a year of, periodic, gentle kind of attempts to check in, it's just something that I don't think that they can really face. And I think that I think as like people on our team who are directly facing this and others in this position, I think that we have a lot of those front-facing conversations with other staff, like other child life specialists and bedside nurses and people who have their own really personal relationships or impressions of these patients and their families and their own grief that they're processing. And so we are actively often having these conversations around gently educating and deterring folks from completing legacy items that are not wanted or requested and providing that education. And so I really, really appreciate you bringing this kind of to light in that way. One thing that I find myself thinking a lot in this work and often like saying with my colleagues and often with those who we're working with families as well is that there's not a right way to do this. There's not a right way to kind of go through the death of your child or to grieve. But that also means that there's not a wrong way to do it. And I feel like that is something that's really helped me and hopefully helped others kind of find their own footing in this, knowing that even though this might not seem right, it's definitely not wrong. About it. Thank you much for sharing.
Thanks, Lizzie. And just to call out for what you and Erica both described, I think there is also, I'm just recognizing that these legacy items that are now locked in your drawer are something that you carry, and I think that can feel hard to to dispose of, and maybe impossible to dispose of, which is why they continue to be locked in your drawer. And so thinking about the kind of ripple effects of unwanted legacy items, not only on families, but also the teams that care for people.
Priya, as a follow-up, I wonder what your thoughts are on for families who are undecided about wanting legacy items of providing a recommendation if they want it. I think about it too with just like sometimes I've seen providers who like actively recommend bringing a sibling to see or meet a child who's going, like a baby who's going to die, and I've struggled on if that's the right or wrong thing to do. So curious, like your thoughts on the appropriateness of recommendations if okayed by the family.
That's a great question. And actually, I wonder if, not to punt, but if there are others in the group who would want to respond to that first. I'll just pause and see if anyone has anything to share.
I think the first thing that comes to mind is that I don't think there's a harm in making a recommendation, in being gentle about it. I think that it often allows the family member, the caregiver, to like hear what they really want. I feel like sometimes there's something in mind, and even in cases where I have given like the very honest recommendation of like bringing a sibling in, or like why I think that in this case it could be helpful when they're really struggling with that. There's often like a very, like they've already very much decided and just kind of like need something to reflect that upon. And so I think that like being respectful about it and being honest will hopefully just lend the family to really being able to hear what they actually have in mind, because they probably have something.
Just going to acknowledge too everything that Lizzie said always, but also just really understanding why they're unsure and taking the time to step back to understand what it is that's making it hard to make a decision, and if there's specific things that they're worried about either one way or another, or specific things that are on their mind, and trying to understand that can also be really supportive, and then knowing how best to potentially offer a recommendation or know what's going to most support the family in that moment.
And I also wonder if in some cases not deciding is a decision in and of itself, and that can be a signal for us too. I see a hand from Susan.
Hi, everyone. My name is Susan Frank, and I'm one of the spiritual care providers at Swedish Cherry Hill on the palliative care team. And I want to talk about two different things. The first is talking about our team bereavement ritual. We have struggled to make this a routine and a regular practice simply for the time it takes. But I think what Erica has said and others have mentioned about having a tangible item after you remember someone that has died. What do you do with it? It's so hard to know what to do with those things. And every so often I try to reevaluate what we're doing. And recently we did a ritual where we seasonally choose an item that is organic, that can go back to the earth. And so in the winter we chose rocks. So every time we had a person that died, we named them, remembered them, and then I brought the rocks outside and returned them to the earth. And it was something that we could let go of, that was then, still surrounding us here, and kind of symbolic in a way of like all these people are still here with us when we walk in the door. And choosing other things, like I think I tried some acorns or some fallen leaves or flower petals, which you also have to be careful in case someone's allergic. So we did run into that problem. Anyway, just being creative about how to let those things go. And then the other thing was we have a quilt program here that the quilts are provided by volunteers. They're beautiful. And they're a lovely gift, but so many people already have enough quilts or closets full of things that their person has made or had been gifted. And so always being sure to give an out about those things. You might have plenty of these quilts in the closet already, but I wanted to offer this to you in case you would find it meaningful. It's always okay to say no. And I do find a lot of times people say, that's not really for her. And you just move on. Thanks for telling me. And you move on to the next thing. So I really appreciate this topic and your sensitivity to the nuance of all of it. I think it's a very sensitive process for people. And we meet everyone in their acute grief stage, most of the time here in the hospital. This has just happened. They may not remember our faces or our names. And I don't think it's always our place to go into this legacy work or push them further along because we know what they might, we think we know what they might want down the road. But just tending to the moment here, this is what we have now, and really listening to what they actually need. I think that's super important. So thank you.
Thank you. Thank you so much for sharing. We have a few minutes left in the hour, but unless there are any more questions or comments, I'm happy to give 7 minutes of your day back.
Thank you, Priya, and everybody for participating in your wonderful thoughts and reflections. This is a really great topic, Priya, and such a excellent time to just reflect together as a group. So thank you for making that space and being so thoughtful. There is the evaluation in the chat if you're able to fill that out, but thank you all for being here.
Thank you so much, everyone.
Thanks, Priya.